My name is Bailli'S and this is my final head-to-toe assessment video. I'm just going to do a quick scan of the room. This is the front of the room. Over here, this piece of paper is just Murray Medical Center narcotic policy hand wipes. Over here we have a chart on postpartum hemorrhage, but that's all that is. Gloves, sharps box. This is all my tools that I'll need to do the examination. This computer doesn't have anything on it, it's just a login screen. Back here is just where we keep our blood pressure stuff. And then on this wall we don't have anything. Let's get started. Okay, my name's Bailey and I'm going to be your nurse today. We're going to be doing a full head-to-toe assessment. Can you tell me your full name?
Vicki Delta.
Okay, Vicki. Can you tell me what your birthday is?
November the 28th, 1970.
Okay. Do you know your allergies?
Yes, I'm allergic to Keflex. It just gives me hives.
Okay. Do you know where you're at right now?
Yes, I'm at Murray Medical Center.
Okay. And do you know what the day of the week is?
It is Saturday,
Okay. And do you know what today's date is?
November the 17th, 2018.
Okay. Who is our president?
Trump,
And who's our vice president?
Pence.
Okay. All right, now we're just going to do some basic information here. How tall are you?
5'4".
5'4". Okay. And then we just weighed you outside the room and you weigh 130 pounds. I asked the nurses if I could bring the scale in here, but they wouldn't let me because they needed it for triage purposes. So we just weighed right outside the room, and Vicki weighs 130 pounds. And with her being 5'4", that would make her BMI about 22. Okay, now we're just going to do a very basic eye exam with the Snelling chart. This is a modified Snelling chart, and you hold it about 6 inches or 6 feet away from the client. This is going to test cranial nerve 2. Okay, can you read this line?
FPH.
Okay. Can you read this line?
OLCF.
Can you read this line?
DHJBS.
Okay. Can you read this line?
EPTZO.
Okay. Can you read this line?
CFDHJ.
Okay. And can you read this one?
LTFPH.
Okay. So Vicki has 20/20 vision when she uses both eyes. I'm going to have you cover your right eye and we'll test your left eye individually. Okay. Can you read this line?
OLCF.
Can you read this line?
DHJBS.
Okay. Can you read this line?
EPTZO.
Yes. And can you read this line?
CFDHJ.
Okay. And can you read this line?
LTFPH.
Okay. Good. So Vicki has 20/20 vision in her left eye. Now I'll have you cover the other eye. And I'll test your right eye. Can you read this line?
DHJBS.
Okay. Can you read this line?
EPTZO.
Okay. What about this line?
CFDHJ.
And this line?
LTFPH.
Can you repeat this last one?
LTFPH.
Okay, very good. So Vicki also has 20/20 vision in her right eye as well. And then we have the 2 colors here that we will assess for color blindness, also cranial nerve 2. What color is this?
Red.
Okay. And what color is this?
Green.
Okay, very good. Okay, I'm just going to look at your face and your head at this point. Your skin, it looks appropriate color for your ethnicity. It looks pink and hydrated. Your face is symmetrical and your skull looks symmetrical. So now I'm just going to palpate your scalp. I don't feel any masses. Do you feel any tenderness?
No.
Okay. Now I'm just going to inspect your hair. Your hair is a fine texture, but it's evenly distributed over your head. It looks shiny and healthy and well hydrated, and I don't notice any dandruff or lice. Okay? Now I'm just going to palpate your facial bones. don't feel any masses. Did you feel any tenderness?
No.
Okay. Now I'm going to palpate the temporomandibular joint. I just want you to open and close your jaw. Okay. There's no popping or clicking, so that's a normal finding. Now I'm going to palpate your sinuses, your frontal sinuses. Any tenderness?
No.
And your maxillary sinuses.
No.
Any tenderness?
Mm-mm.
Okay. Now I'm going to percuss your sinuses. Any tenderness?
No.
Any tenderness?
No.
Okay. Very good. Now, I forgot. Okay. Okay, now I'm just going to assess your eyes. I'm just going to have you look at me. I'm just going to look at the symmetricalness of your eyes. I see that they are symmetrical and your eyebrows are symmetrical as well. Now I'm just going to look at your eyelids. I don't feel any masses in your palpebral folds. I don't feel any masses. Okay, did you feel any tenderness when I was touching you?
No.
Okay, and your eyelashes are evenly distributed. I don't notice any flakes or discharge. Now I'm going to put some gloves on. And I'm just going to palpate your lacrimal apparatus. I don't feel any masses. Do you feel any tenderness?
No.
Okay. Now I'm just going to look at your sclera. Just look straight ahead. Okay, your sclera is white, so there's no yellowing. Your conjunctiva on both sides is moist and pink, and then your irises are equally round bilaterally. Now I'm just going to perform some optic exams. I'm going to test your pupils. I just want you to look straight ahead. Okay. And so with these pupils were about 3 millimeters until I shone the light into them, and then they were reactive and round, and so they went down to about a 2 when I shone the light in them, and they were brisk. So now I'm going to test for accommodation. I'm just going to have you look at my finger and follow it in. Okay, and her eyes do accommodate because they're able to follow an object when it gets close to her face. Now I'm just going to do some more optic exams. I'm going to do the corneal light reflex. I just want you to look straight ahead. Okay, and the corneal light reflex is present in both eyes. Now I'm going to test for red reflex. Just again, look straight ahead. Okay, very good. The red reflex was present. Now we're going to do the cover-uncover test. I'm going to have you cover your right eye. And I want you to follow, let's see, yeah, cover it about like that. Okay. Now I want you to follow my finger and uncover your eye. Very good. Okay, now we're going to do that other eye. Okay, and I want you to follow my finger with your eye. Okay, now uncover your eye. So, there was no abnormality with the cover and cover test. Both her eyes were able to follow my finger. There was no deviation in the eye that was covered up, so that's a normal finding. Now I'm going to test your peripheral vision. You just sit right there. And this is cranial nerve 2. I want you to tell me when you can see my hand. Now, okay. Tell me when you can see my hand. Now, okay. Her peripheral vision is intact. Okay, now I'm going to test for extraocular eye movements. This is cranial nerve 3, 4, and 6. I just want you to follow my fingers with your eye. Her extraocular eye movements were intact. She was able to move her eyes over all the 6 cardinal fields. Now I'm going to test cranial nerve 5 with the corneal reflexes sensitivity. I have this little wisp of cotton drawn up on this cotton stick. And I'll test each eye. Okay. The right eye corneal reflex is intact because she blinked. And then I will test the left eye. Okay, her left corneal reflex was intact because she blinked. Okay. Now I'm going to do an assessment on your ears. Just looking straight on, your ears are symmetrical and equally aligned on your head. Now I'm just going to palpate and inspect each ear. Okay, tell me if you feel any tenderness. I'm palpating the auricle as well. Any tenderness?
No.
I don't know any masses or flakes, scales, moles, or anything like that on the outside of her ear. Okay. Now I'm going to do an otoscopic exam. I'm just going to take a clean tip and put it on the end. Okay. Now it's important to hold this instrument correctly so that we don't hurt the client's ears. I'm going to hold it upside down with my fingers on the outside. I'm just going to take a look into her right ear. Okay, I'm able to see the tympanic membrane. It is a pearly gray color. I see the light reflex on the tympanic membrane. Her ear canals are not inflamed. Okay, now I'm going to look into the other ear. Okay, I'm able to see the tympanic membrane. It's a pearly gray. I see the light on the tympanic membrane, and the ear canals are not red or inflamed. Okay, now I'm going to do the whisper test. I want you to tell me, and this is cranial nerve 8, I want you to tell me what you hear. A, B, C, okay? And then it's here. 1, 2, 3. Okay, very good. Now I'm going to perform the Renee test. I'm going to strike the tuning fork and then place it on the bone. And I want you to tell me on the mastoid bone here. And I want you to tell me when you stop hearing it. And then just hold up a finger. And when you've stopped hearing it, I'm going to move it just away from your ear here. And I want you to tell me when you stop hearing that. Okay. And that was a normal finding with the Renee test because air conduction is twice as long as bone conduction. Now I'm going to perform the Weber test. Can you hear it on one side more than the other? Is it equal on both sides of your ears? Yes. Okay. Very good. So the Weber test was normal because she was able to hear the vibrations equally in both sides. It wasn't stronger on one side more than the other. Okay. Now I'm going to do an assessment on your nose. Just looking at you straight on, it's symmetrical. Your septum looks midline. I'm just going to put a clean tip here. And look in your nose. Okay. The septum is midline. Her nasal mucosa is pink and moist. Her turbinates are very small, which is good, so that means that she's probably able to breathe very well. Now I'm just going to test the patency of your nostrils. I'm going to hold this side in. Can you breathe through that nostril? Okay, very good. What about this side? Okay, so both nerves are patent. She's able to breathe. Now, I'm just going to test her sense of smell, which is cranial nerve 1. I want you to close your eyes. What does this smell?
Citrus, like orange.
Orange, okay, very good. And what does this smell?
Cinnamon.
Okay, very good. So your sense of smell is intact. One thing that we didn't do earlier that I'm gonna do real quick, it's for cranial nerve 2. It's the Rosenbaum chart, and it tests your near vision. So you hold this approximately 36 centimeters from the client's eye. I'm gonna have you look with both eyes. Can you tell me what this line says?
Am I telling you the numbers?
Yes, the numbers right here.
Okay. 8745
Okay,
63925
okay, this line,
428365
okay, this line,
374258
okay, and this line,
937826
okay, and this line.
426739.
Okay, very good. Now I'm gonna have you cover the right eye, and then we'll test your left eye. Can you read this line?
428365
Can you read this line?
374258
Okay, can you read this line?
935826
Okay. And can you read this line?
426739.
Okay, very good. She has 20/20 vision in her left eye, with her near vision. Now we'll do the other side. Can you read this line?
428365
Can you read this line?
374268
Can you read this one?
937826
Can you read this one?
428739.
Yes, so she has 20/20 vision, nearsighted in her right eye as well. Okay, now I'm just going to, what we didn't do earlier, I needed to test the sensation on your face. I just want you to close your eyes. This is testing cranial nerve 5. Tell me when you feel the cotton whisk.
No.
Or did I touch it?
Forehead. Chin. Left cheek. Right cheek.
Okay, very good. Okay, now I'm just going to look at your mouth. I'm going to take this tongue depressor here in my lot. I'm just looking at your lips. Hang on just a second. I'm just looking on the outside at your lips. Okay, open your mouth. I'm looking at the buccal mucosa. It is pink and moist. Okay, I'm just going to inspect your gums. Your gums are pink and moist. I don't notice any gum line receding. Your hard palate is intact. Stick out your tongue just a little bit more. Okay, and your soft palate is intact as well. The floor of your mouth is also pink and moist. Okay, now we're going to look at your oropharynx. Just stick out your tongue for me. Okay, I see your anterior, posterior pillars. They're intact. Your tonsils are 1+, and that's a normal finding. Your uvula is midline and intact, and the posterior pharynx is also intact. I don't notice any odor coming from your mouth. I'm just going to take a quick look at your teeth. The client doesn't have any dentures. She has all of her teeth and they are white. I don't see any dental cavities. Now I'm just looking at your tongue. It is symmetrical, and it's pink and moist. Can you lift your tongue up? Can you lift it down? Okay, can you lift it side to side? Okay, and her range of motion with her tongue is good. Okay, now I'm just going to inspect your neck. Just looking at you straight on, your neck skin looks smooth. I'm not able to see your thyroid right off, but your neck looks symmetrical. Now I'm just going to palpate. I'm going to come around the back and palpate your thyroid. I'm not able to palpate the thyroid, which is a normal finding because we don't want the thyroid to be enlarged. Now I'm just going to palpate your tracheal position. Your tracheal position is midline, which is a normal finding. I'm going to palpate your carotids just one at a time. 2+ on the left side. And 2+ on the right side. Now I'm just going to take a listen to your carotids. I don't hear any bruits, which is a normal finding, and I wasn't able to feel any thrills when I palpated. So now I'm also going to listen to your thyroid. Okay, and I'm not able to hear any bruits over the thyroid, which is a normal finding. Now I'm going to test the range of motion in her neck. I want you to look side to side and up and down and touch your shoulder with your side of the neck and touch the other side. Okay, very good. So her range of motion is intact. I'm going to have you turn your head against resistance. Okay, very good. Turn your head against resistance. Okay. Now I'm going to test the shoulder shrug. I need you to, this is going to be cranial nerve 11. Shrug your shoulders against resistance. Okay, and she's able to do that as well. So that is intact. Now I'm just going to palpate her lymph nodes. We have the preauricular, the postauricular, the occipital, the tonsillar, the submandibular, the submental, the superficial posterior chain, the posterior cervical chain, the supraclavicular, and the infraclavicular. Okay, and then I wasn't able to palpate those. Lymph nodes, so that's a normal finding because we don't want those to be enlarged. Now I'm just going to assess her upper extremities. I'm just going to feel her shoulders, upper arms, lower arms, hands. I don't feel any masses. Is there any tenderness when I touch you?
No.
Okay. Now I'm going to feel your epitracheal nodes, which I'm not able to feel, which is a normal finding. Okay. Now I would test for capillary refill, but she has a burgundy nail polish on. Now I'm going to assess her brachial pulses, 2+ bilaterally, and her radial pulses, 2+ bilaterally. Now I'm going to test the range of motion in your fingers. Can you, okay. Now your wrist, can you go down, up, out, and in. Your elbows go up, okay. Your shoulders go up, make forward circles, okay, and backward circles. Okay, her range of motion within her upper extremities is good. Okay, now I'm just going to inspect the rest of her body while she's sitting here, and I see that her skin is normal for her ethnicity. It looks pink, it looks real hydrated. I don't notice any flaky skin or dry skin. Just looking at her musculoskeletal development, it's symmetrical bilaterally, and it looks appropriate for her age and gender. Now I'm just going to palpate her chest wall. I don't feel any crepitus, and I don't, it feels stable. Did you notice any tenderness?
No.
Okay, now I'm going to palpate the precordium. I don't feel any pulsations or heaves. And just upon inspecting, I don't see any pulsations or heaves. Now I'm just going to feel your axillary nodes, which I cannot feel. Do you have any tenderness?
No.
Okay, so I can't feel those, which is a normal finding because you don't want those to be swollen or enlarged. Now I am going to palpate for a tactile fremitus. Won't you say 99?
99.
Okay. And 99?
99.
Okay. Very good. The tactile fremitus was absent, which is a normal finding. Now I'm just going to percuss. And she is resonant over her lung fields, which is a normal finding. Now I'm just going to take a listen to her breath sounds. I just want you to breathe in and out normally. Okay, her breath sounds are clear in all loads. I didn't notice any adventitious sounds such as wheezing or bronchi, stridor, anything like that. And so now I'm just going to take a listen to your heart sounds. Aortic, pulmonic, Erb's point, and the apical mitral area. I heard S1 and S2 heart sounds. I didn't hear any S3 or S4 or any gallops or any abnormal heart sounds. And just looking at her posture while she's sitting here, I see that she's sitting upright and erect. I don't notice any stooping or slouching. And then also just looking at her respirations, I see that she's unlabored. I have no reason to think that she's short of breath because there's no retractions or nasal flaring or anything like that. Okay. And normally we would do the breath sounds and the heart sounds with our stethoscope directly on the skin, but for the purposes of our video, and for the client's privacy, we just did it through the clothes today. Okay. Now I'm going to go around the back and then inspect your back. You just sit upright. I'm going to have you lift your shirt up for me, and then you just hold it right there. I'm just inspecting the skin. It's pink and it's warm and dry. Her musculoskeletal development is appropriate for her age and gender. I do notice some freckles across her back, but nothing that looks abnormal. And her thoracic configuration is symmetrical. I'm just going to feel your scapula. They are symmetrical as well. Do you feel any tenderness? No, I don't feel any masses. I'm just going to palpate her spine. I don't feel any lumps or masses. And now I'm just going to percuss your spine. Did you feel any tenderness? No. Okay, no tenderness on the spine, which is a normal finding. And her spine looks in normal alignment. And just looking at her breathing while she's sitting there, just looking at the excursion, depth, and the rate, rhythm, and pattern. She's breathing at a normal depth. She's not breathing too deep or too shallowly. And her respirations are regular and even. Now I'm just going to touch you, ma'am. It's not be cold. Okay. Now I just want you to breathe in normally. I'm just feeling for expansion on her chest. And her chest expansion is equal bilaterally. Okay. Now I'm also going to assess for tactile primitus on the back. I just want you to say 99.
99.
Okay. And say 99 again.
99.
Okay. Very good. The tactile primitus was absent, which is a normal finding. Okay. I'm going to need my measuring tape in just a moment. Okay. First I'm just going to palpate your chest, the posterior chest. I don't feel any crepitus. It feels stable. Do you note any tenderness?
No.
Okay. Now I'm just going to percuss. And she is resonant over her lung fields, which is a normal finding. Okay. Now I'm going to assess for diaphragmatic excursion. It just tests her lung expansion by percussing the diaphragm. Now I'm going to bend down. I'm going to percuss. I'm going to let you take a deep breath in and then breathe out all your air as much as you can fit out. Now, I'm going to just make a little nail mark right there so I know. Okay. Now I'm going to have you breathe in as much as you can. Okay, make another little nail mark right there. Now I'm going to measure. diaphragmatic exertion is about 3.5 centimeters, which is a normal finding. She has good lung expansion. Okay, now I'm just going to listen to your breath sounds, okay, and just breathe in and out normally. Okay, breath sounds are good. I do not hear any adventitious sounds such as crackles or wheezing, wrong high stride, or anything of that sort. So all breath sounds were clear in all lobes. And then when I palpate her lateral walls, they are stable as well, and they are resonant on percussion. Okay, now I'll just have you lay back on the bed. And while you're laying back at this 30-degree angle, I'm going to assess for jugular venous distension. So just lay back normal. Okay, and I don't see any jugular venous distension, which means that her fluid volume is in balance. Okay. One thing that we didn't do earlier that I want to do now is the taste test. And this is going to be cranial nerves 9 and 10. And I'm going to let you close your eyes and tell me what you taste.
Sweet.
Okay, next one.
Salty.
Okay, very good. And then one other thing I didn't do earlier was test for the gag reflex, which is cranial nerve 9. Okay, just open your mouth. Okay, so the gag reflex is intact. Okay, now I'm just going to assess your abdomen. I'm just going to lay you back down a little bit more. And I'm going to have you lift up your shirt just a little. Okay, just inspecting her abdomen. It is flat, and noticing the skin on it. It's pink, and her skin looks appropriate color for her ethnicity. Now I'm just going to take a listen for bowel sounds. She's normoactive in her right upper quadrant. She's normoactive in her left upper quadrant. She's normoactive in her left lower quadrant. And she's normoactive in her right lower quadrant. So all bowel sounds were present. Now I'm just going to, now that we have inspected and auscultated, I'm just now going to percuss. Okay, so she had some dull sounds on percussion over her liver, but then over the rest of her abdomen, it was tympanic, which is a normal finding. Now I'm going to palpate lightly. Do you feel any tenderness? No. Okay, and I don't feel any masses or lumps. Okay, now I'm going to palpate deep. Tell me if you feel any tenderness. No. Okay. Upon palpation, there was no tenderness, no masses. I was able to palpate her liver in the right upper quadrant. I wasn't able to palpate her stomach or spleen, which is a normal finding. That means that they're not enlarged. Okay, now I'm just going to palpate your abdominal lymph nodes. They run down the middle of your abdomen, and then they branch out towards each leg. I'm not able to palpate those, which is a normal finding. It just means that those lymph nodes aren't enlarged. Okay, now I'm going to test abdominal reflexes. I'm going to take the end of this cotton tip here and I'm going to go in towards your belly button. Okay, and when I do that, her abdominal muscles contract, which means that her abdominal reflexes are intact. I'm going to sit you up just a little bit. Okay. I see your abdominal muscles are appropriate for your age and your gender. I don't notice any abdominal hernias, which is a normal finding. I'm going to palpate for your femoral pulse. And normally we would do this skin to skin, but just for the client's privacy today we won't. Okay, and your femoral pulses are 2+ bilaterally, which is a normal finding. Now I'm going to move on to your lower extremities. I'm just inspecting your legs. Your musculoskeletal development looks appropriate for your age and gender. Your legs and feet look symmetrical. Your skin looks warm and dry and pink and appropriate for your ethnicity. Now I'm just going to feel your legs. Tell me if you feel any tenderness. Any tenderness? No. Okay. There's no tenderness noted, and I did not feel any masses or lumps. Now I'm going to assess her pulses, her popliteal pulses, 2+ bilaterally. Her posterior tibial pulses are 2+ bilaterally. And then her dorsalis pedis pulses are 2+ bilaterally, which are normal findings. And at this point, I would normally check capillary refill, but she's got burgundy nail polish on her toenails. Now I'm just going to test muscle strength and range of motion. I want you to push down on the gas pedals, okay? And pull up against my hand, against resistance, okay? And I want you to lift your legs against resistance. Okay, very good. So her muscle strength is 5+. Bend your ankles down, bend them back up. Can you bend your knees up? Okay, then you can let them down. Now I'm just going to palpate your hips. Your hips are equal and symmetrical bilaterally. Now I'm going to let you cross your legs like this. Okay, I'm just testing the range of motion of your hips. Can you lift this leg? Okay, put it down. Can you put it out? Okay, same with this leg. Up and side. Okay, very good. So she has full range of motion on her hips. All right, I'm just going to let you sit up on the side of the bed. I'll help you. Okay. And when she sat up on the side of the bed, I was just noting her use of muscles and her coordination, which was appropriate. I didn't think that she had any trouble with balance or coordination. Okay, now I'm just going to have you close your eyes, and I want you to tell me when you can feel the touch. Left upper arm, okay. Right upper arm. Left lower arm, okay. Right lower arm. Left leg, right leg. Left shin, right shin. Okay? Very good. Now I'm just going to test some of your reflexes. I'll test the patellar reflex bilaterally. Just let your feet angle. Okay. Patellar reflexes are intact bilaterally. I'm going to test the plantar reflex. Okay. Okay, it's intact bilaterally. Okay. Now I'm going to test the dorsal reflex on your back. And her back muscles moved when I tested that, so that means that her reflexes are intact. Now I'm just going to test the coordination. I'm just going to have you run this heel up this shin like this. Okay, she's coordinated with her movements. I'm going to have you do the same thing on the opposite leg. Okay, she's coordinated with your movements. I'm going to let you put your shoes on, and I'm just going to observe you tying your shoes so I can see the use of your fine motor skills with your hands. Okay, she was able to tie her shoe without any difficulty. And she was able to tie that shoe without any difficulty. Now I'm going to test your position sense. I want you to put your hands on my hands and close your eyes. I want you to push my hands down, push them up, push them to the right side, push them to the left side. Okay, she has good position sense because she's able to close her eyes and be able to be aware of her position. Now I'm just going to let you stand up. I'm just observing her spine. She's standing upright. I don't notice any kyphosis or lordosis. Her spine is in equal alignment. Now I'm just going to have to bend over, and I'm going to look for scoliosis. Okay, I don't see that S shape that's classic of scoliosis. Her spine again is in equal alignment. Now I'm going to perform the Romberg test just to test your balance. I'm going to have you close your eyes and then just stand straight. Okay, the Romberg test is not abnormal. There's normal findings because she's not swaying or losing her balance as she closes her eyes. Now I'm going to have you just walk towards the door and back so that I can observe your gait and how you're walking. She's steady on her feet, and I don't notice any issues with her walking, and she's well balanced. Okay, now I'm going to have you walk heel to toe to the door. She's still able to maintain her balance and her coordination walking heel to toe. Now I'm going to have you do the duck walk towards the door. Okay, she's able to maintain her coordination and her balance as she's walking to the door and back. Okay, very good. Now I'm just going to have you stand on one foot. Can you hop on that foot? Okay, very good. She didn't lose her balance, and do the same thing with the other foot. Okay, very good. And she didn't lose her balance. Now just do shallow knee bends. And she's able to use her muscles appropriately, and she has full range of motion. All right. Well, that concludes our head to toe assessment. And you're healthy.